Hi, I'm Mackenzie Yazzie Martin.
My name is Elijah Harry.
So today we'll be talking about an evaluation program, which is Expecting Mothers and Opioid Disorders Awareness and Testing. So the introduction for our program is we are evaluating the program of Expecting Mothers and Opioid Disorder Awareness Testing. The purpose is to provide expecting mothers with a sense of safety against discrimination and stigmatization during hospital visits, as well as bringing awareness to opioid disorders. Opioids are a natural or synthetic chemical that interact with opioid receptors on the nerve cells in the body and the brain and reduce feelings of pain. Such examples include of opioids are synthetic opioids, which are fentanyl, opioid, which is a drug also called hydrocodone, or illicit drugs such as heroin. Expecting mothers can be prescribed a certain amount of prescription drug or use opioids recreationally.
So the description of the program is that's being evaluated. There's 4 interventions that are going to be happening. The pre-pregnancy, which is bringing awareness to the mothers on opioid disorders. The prenatal stage, which is providing medical screenings to mothers for substance use as part of prenatal care. Birth, which is the testing of newborns for substance exposure. And neonatal, which is conducting developmental assessments of barely born humans and ensure access to resources if they have opioids in their system.
Okay, so for our evaluation design, what we did was we had 100 expecting mothers will be asked a series of questions in a one-on-one interview session. So this is to give them or to find out the experience that they have went through for each intervention. So for intervention 1, the evaluation questions for pre-pregnancy, also awareness, is what are your thoughts on the mothers with opioid disorders? PowerPoint. Was interaction with the promoter engaging? Why or why not? Was the location of the interview suitable to speak openly about learned topics? Those are the 3 questions for pre-pregnancy awareness. And then for the intervention 2, prenatal is did the location of the screening make you feel comfortable? Were the healthcare providers easily to communicate with? Was the test screening results easy to comprehend?
Alright, and for intervention 3, which is the birthing stage, is going to be where the healthcare provider is able to provide insight of what will happen when the baby comes. Were you comfortable giving consent to the nurses and doctors for prenatal substance exposure testing after giving birth? And were the resources provided by healthcare providers accessible and apprehensible? Intervention 4, which is on the neonatal stage, is where resources provided reliable. Were healthcare providers open to discussion topics on the opioid disorders, and were resource locations easy to access and were resources locations easy to access and did staff provide a sense of understanding?
So our next slide is data collection. For data collection, we will be collecting the one-on-one interviews from 100 expecting mothers. All answers will be interpreted and transcribed from evaluation questions. Mother's identity will be concealed through an identification number to limit bias. All questions will be asked in a secure location. All working personnel will be provided with a tape recorder and notepads to record responses.
Alright, so data analysis and interpretation is what's going to happen next, and what this is to ensure that performance is being evaluated. And so to ensure that is workers will be provided with all interview questions from the prenatal stage all the way to the neonatal stage, and they would also have communicated with patients during an interview and provide a sense of security where patients are welcome to answer all questions openly. Workers will then play back all data recordings to report accurate records, and identifying keywords from patients is how we're going to collect that data. And we're going to associate feelings that are common in all interventions, such as feelings of comfortable feelings, not having pressures, like too much pressure on themselves, very informative, and feelings of vexing, which is like happiness, sadness, uncomfortableness, and like various other keyword terms.
Our next slide will be on communicating and reporting. So our communicator with you as stakeholders will be as follows. So we want to invite you to our first meeting before implementation of the program. And then we'll give annual writing reports on status of the program to ensure timeline. You will be invited to the last meeting so that we can report all final findings within the program. All personnel within program of study will report to supervisor with written reports and collected data.
Alright, so next slide is evaluation management, and so this is where we talk about who's going to be running the program. First up is Yazi Martin. He will be implementing the program. His qualifications include working for Fit Families, where he implemented presentations on cooking and nutritional foods to local families in Las Cruces. He recorded pre-test and post-test evaluating knowledge learned from the program. And he will He will oversee collected data from the one-on-one interviews and manage personnel to different patients to ensure confidentiality. And then next step is me. I will oversee timeline to ensure program to completion. My qualifications include implementing special events through the Native American Business Student Association, and I will remain in constant communication with the stakeholders and working personnel to ensure all communication is working correctly, and also manage the budget of the program to ensure resources are being utilized.
So this is our last slide, which is cost analysis. So for the overall program, it'll be $151,000 overall cost. Each participant will receive a $50 gift card to buybybaby.com, which is a total of $5,000. Cost of printing of questionnaires, brochures, and supplies equals a total of $1,000. The evaluator will be $20,000. Healthcare workers will get about 15 each, which is a total of $75,000. The program coordinator will get $25,000. So, thank you for listening to our evaluation program presentation. I am Mackenzie Yazi Martin.
My name is Elijah Harry.
Okay, and then this will conclude the presentation.
Thanks. Until next time. Bye.